Today I want to talk about something really exciting, gum disease. Gum disease is strange because it's one of the things that I see probably most commonly overtreated and undertreated. Patients all the time will come in, they've been going to the same dentist for years and years, getting regular cleanings every 6 months, and when we take the x-rays and take their gum measurements, they have lots of calculus underneath the gums, down deep where it's just never been accessed. Flip side of that coin is we have patients who come in and say, oh yeah, my last dentist was giving me preventive deep cleanings. He was worried my numbers were going to get deeper, so we were doing preventive deep cleanings. And you see both sides of that frequently, where either dentists are afraid to treatment plan periodontal disease because it's not covered in the patient's standard twice a year basic cleanings. The patients just want to come in and get their twice a year cleaning. Or some dentists may be over treatment planning it because they want to make money off of it. Really, periodontal disease, gum disease, pyorrhea, whatever you want to call it, it should be pretty straightforward to diagnose. If there's calculus present, tartar present on the x-rays, if the gum measurements are showing deep readings, bone loss, then there's a need for a deep cleaning, scaling and root planing, gum infection therapy. The terminology gets confusing with periodontal disease because there's so many different names for the disease itself, the treatment options, and there's just a lot of misconception surrounding it. It's a hard one because you don't feel gum disease. If you have a big cavity in your tooth, it's going to start to get sensitive. Or if you have a broken tooth or a hole in your tooth, you can feel it with your tongue. But gum disease is going to progress slowly, and it's mostly underneath the gums. You might get an occasional iron taste in your mouth where it tastes kind of like you've got metal, or you might notice more bleeding when you brush or floss, but not until you get into the really advanced stages where you start to notice anything. And by then you're getting loose teeth, bad smell in your mouth, bad taste in your mouth, pretty severe side effects. And a lot of times once your teeth are getting loose, it's too late to do much about it, unfortunately. So here at Mill Pond Family Dental, we use a very consistent approach with every new patient that comes in. We take a full set of gum measurements, we take a set of x-rays, we do a digital scan, and we can use all three of those pieces of information to look and see how much calculus is there above the gum, how much calculus is there below the gum, what are the gum measurements, how much bleeding are we getting on the gum measurements. And using all that criteria, you can come up with a formulated plan specific for that patient. And then as we carry through with routine care, whether you do have gum disease and you need a deeper cleaning to treat the disease and then are put into a maintenance phase, or if you don't have gum disease and we just pick up with regular routine cleanings, we're always checking back in. We're taking routine x-rays, we're taking routine gum measurements. We want to stay on top of everyone's health, and we don't want to either overtreat or undertreat anyone, but we want to keep people as healthy and stable as we can, and we want to educate. This is what's causing gum disease. This is how you can prevent gum disease. So brushing your teeth twice a day, flossing your teeth once a day. If you have higher risk factors such as certain bacteria, I'd say use a Listerine mouth rinse once a day. Some people, just the cookie cutter every 6 month cleaning isn't going to work out well. If you're in braces, or if your mouth builds up tartar more readily, or if you have had advanced gum disease in the past, we might have you coming in every 4 months, every 3 months, in some severe cases, maybe even every other month, just to really stay on top of that. Everybody's disease is different and everybody's treatment is going to be different. It's not just a cookie cutter approach, but we want to make sure we're treating every patient appropriately and giving them the best care that's possible.